We are here at Symbios. I am thrilled to talk today to Sarah Malone. It's so nice to meet you.
It's great to have you.
You're a board-certified nurse practitioner in women's health. I'm really excited to have the opportunity to share a bit about you. We are in this wonderful facility, which is so diverse and multifaceted and has so much to offer. We thought our viewers would love to chat a little bit about women's health specifically. What services do you offer?
So where I'm at is the women's health pod of Symbios. And so we're a well-rounded clinic, and we want to approach every individual from multi-faceted areas of health. So for me in the women's health pod, I'm going to focus on problems specific to the female population.
Okay.
Now we go from ages 12 and above.
That's right.
And so with each, everybody that comes in a different chapter of their life. So it depends on what chapter in your life in, and that's the area that we're going to focus on.
What's been really fun in talking to you and getting ready to actually chat is the thing that you said about I listen to my client. Because I ask you, do patients know themselves? And you said if they're led with the correct questions and the interest in them.
Right.
And you said that's part of the fun that you all do is really get to know your client, develop relationships.
Right. Yeah, I mean, there's standard guidelines and practices for clinical care, but for each woman, nobody has ever treated you before. Right? And nobody has ever had your problem with your experiences. And so our specialty is really getting to know you and individualizing the care so that you can be the best version of yourself.
I have kids that are 17, 35, 45, and I'm 68. And I can imagine what we're each interested in is very different. For me, I found as I'm aging, incontinence and things like that people don't like to talk about, but it's just the reality of the world. And you said you've got lots of different disciplines to direct us to.
Right, and you're exactly right. And that's a problem that we've had in the past where, there's some things that women don't want to talk about with their partners or with their girlfriends, and they come into our pod and we lay it all out on the table because this is a conversation. It's not just you dealing with incontinence. I've seen 4 other women today dealing with the same problems. So here's how we're going to treat it because I'm going to target my treatment towards the type of incontinence that you're having.
Okay.
So there's so many different types, of problems, and we really target the therapy towards you.
Based on my experience in the past with other providers, I often feel as though I'm kind of told a direction to go.
Right.
What I hear you say is there are a lot more options available, and together we maybe make some decisions?
Exactly. So I'm going to give you all the options available, and you're going to choose what works best for you, for your lifestyle, and what you think is going to optimize your health.
How does Symbios Pod and some of the interdisciplinary things you do affect, let's say we make a decision and you're like, I don't know, exercise or whatever it is. Will you help guide me in that whole thing and then actually refer me?
Exactly. So we have right now just I think 4 or 5 different providers on the floor.
Okay.
We are constantly stepping next door, popping our heads in each other's offices. What would you do for this? Hey, I've got someone that came in for incontinence, but guess what? Now she also has back pain. So I'm going to pop my head in and say, hey, Greg, what would you do for this back pain? Can I schedule her to visit with you next week? So we're very collaborative care, and I think that's something that's very unique, not just to the island, but healthcare model in general. And so I'm very excited to be here and be a part of this.
Talk to me about establishing myself as a patient. What is the procedure for that? How do I go about getting to know you better?
Right. Well, so you'll call the girls up front and they're going to determine who's the best fit for you. So out of all the providers, what are your needs? What are you looking to get out of your appointment with us? They're going to determine because each of us is our own specialty with our own personality.
Which is amazing.
And our own approach to care. So the girls are going to determine, okay, you'd be a great fit for Sarah, and Piper and the girls down there. So I'm going to schedule you with them. We're going to tackle the problems, and see what works best for you. And if I can't take care of it all, guess what? I've got someone next door that can.
Welcome to Symbios.